The U.S. Arab Radio Network is the largest Arab and Muslim radio network in America, broadcasting throughout the Midwest region Monday through Friday on WNZK AM 690. U.S. Arab Radio features Arabic and English language programming on every topic, from health, food, and culture to government, politics, and legal issues. Listen live to U.S. Arab Radio in Michigan, Toledo, Ohio, and Windsor, Canada on WNZK AM 690. And in Washington, D.C., Maryland, and Virginia on WDMV 700 AM. You can also follow us on Facebook, Instagram, X, and TikTok. So join us every day on the U.S. Arab Radio Network and check out our website at www.arabradio.us.
Good morning and thank you for being with us. This is Khalil Hachem with U.S. Arab Radio. Happy Tuesday. We have a great show for you today, focusing on family health. You know, family is the important component of society. Regardless of your political beliefs, you need male and female to reproduce. But studies have shown that family health really starts before a family is formed. And it should be that way anyway. If we take a few tests, it would help us to form a more healthy family. It would give us the knowledge on what to expect. At least this is the smart way to do it, experts believe. With us this morning is Dr. Nicholas Shamma, a founding member of IVF Michigan and Ohio Fertility Centers. He is a globally recognized expert in reproductive medicine, with more than 30,000 IVF cases, successful I should say, performed worldwide, and more than 150 published works. His contributions are driven the next generation of fertility care. Good morning, Dr. Shamma, and thank you for being with us.
Good morning, Khalil, to you and to all our listeners this beautiful morning in Michigan.
Absolutely. And we haven't talked to you for a while, so what's with you? Give us a very quick, for our listeners, who what you do and who you are, and what's new with you, and then we can get into the topics that we're going to be talking about.
Yeah, I mean, 2025 has been an interesting year for us at IVF Michigan and Ohio Fertility Centers for actually two main reasons. The first reason is, as of March of 2025, we joined a leading fertility group in the United States, Pinnacle Fertility, and so we're one of their larger programs, and it's allowed us to go into the next generation of fertility care in the United States. Mm-hmm. So that is one thing that happened to us, and we're very pleased to be joining that group. The second, which happened in the state of Michigan for us, is a big deal, is that as of April 1st of 2025, which is a month later, it became codified into law, the Gestational Surrogacy Act that was signed by the governor in Michigan, and we were the last and 50th state in the nation that basically allowed and regulated now paid gestational surrogacy, offering another path to parenthood for those people or intended parents that for one reason or another cannot conceive themselves, but need somebody to carry the pregnancy for them.
Sure. Yeah, could you explain that a little bit more so people will understand?
Yeah, I mean, remember, in assisted reproduction or in vitro fertilization, we, generally speaking, have to have embryos, and then those embryos, one embryo at a time, is placed into the uterus of the mommy, and the mommy delivers the baby. So that's really in a very, very simplistic way. But sometimes, Khalil, in situations whereby, let's say, the mom cannot carry a pregnancy safely because of medical risks, or somebody decided that she doesn't need a uterus, or the uterus was taken out because of disease or because of whatever happened to the uterus, so somebody else has to carry for her. And there are situations where somebody is born without a uterus, or a misshapen uterus of some sort, and that also requires another person to gestate the pregnancy for them. There are also situations, if you have two gay men, for instance, there's no human way they can have a baby without the help of a female. So again, somebody else will carry the pregnancy for them. In all of those instances, gestational surrogacy is the only path to parenthood in those situations. we were the last state to make it basically legal, because it was until then illegal in the state of Michigan. I mean, I'm a little bit biased because I love the law that was passed, and it absolutely helps people achieve this type of parenthood option, and in a very safe and humane way, covering both intended parents and gestational carriers at the same time. Meaning that the law helps both of those people in their journey to parenthood.
So basically, that person, that woman, would be like a host for the fetus.
Yes, that's one way of saying it. And we have an agency. I mean, we have the Gift of Life Surrogacy Agency. It's our agency. It's a sister company that we have, and it helps those intended parents, through that journey to parenthood using that option, because there is a lot of facts that need to be addressed, whether it's legal, whether it's social, whether it's psychological, whether it's medical, all of that stuff, before you have that basically commitment between the gestational carrier to carry safely the pregnancy for those intended parents.
Absolutely. Now, when you take the embryo and you put it in somebody's womb, does that embryo take any DNA from the host?
It doesn't.
Okay.
Embryo itself belongs to the intended parents, no matter how.
Which is where the egg came from, and then the sperm that came from to fertilize that egg. She's only a host, does not really affect the DNA of that embryo.
It does not. Her DNA does not contribute to the DNA of the embryo.
So that particular child or potential child is the son or daughter, or the child of the whoever gave the sperm and then donated the or gave the egg. Right. Not the egg. Is the egg the right thing? Yeah. Okay. Yeah. Wow. That's really something. It's another tool.
It's a big deal for us in Michigan. We've been doing it for years through our centers in Ohio, but now it is codified into law in the state of Michigan, and it's an amazing law that was.
Have you started on any cases?
Yeah. I mean, we're the largest in Michigan and Ohio by far. So I mean, of course.
Yeah, I'm sure these people are happy.
I mean, I've been doing it for 30 years.
Yeah.
But now the fact that we can do it legally in Michigan makes it very helpful.
Absolutely. Yeah. Anything else is new?
The field itself, there's a lot of new things in the field that are happening, and a lot of those technologies that are coming to assisted reproduction, meaning to in vitro fertilization, have been in concert with what is happening in the rest of the technology world. For instance, we now have a lot to do with incorporating machine learning or deep machine learning into the processes that we do, whether in the way we stimulate people to make them produce eggs, women, or in the way we actually monitor embryos in the laboratory to be able to choose the best embryo, best genetically normal embryo for us to transfer in the women. All of those factors helped dramatically in achieving a better pregnancy rate and a healthier pregnancy going forward. So all of those systems will become more controlled by artificial intelligence. There is also robotics playing a major role in our field behind the scenes in the laboratory. And what that does, Khalil, is think about it this way. A lot of the processes that we have in taking the egg, injecting the egg with the sperm microscopically and so on, can be done by robotic systems. And we have so many steps in the laboratory, almost 35 different steps just to get the egg and the sperm to come together. A robot can potentially do that instead of a human. And now we are incorporating those systems in the laboratory, again, to some degree, increasing the efficiency of the system. Also, we're incorporating something called microfluidics in the system, which is another layer of what we're doing in the laboratory to achieve a better success rate and a better outcome, especially in the way of using that with, again, artificial intelligence and deep machine learning in picking the right sperm or finding the right sperm in a sample where that sperm is sparse or is not as viable as in other situations. So all of those things we're doing behind the scenes, people don't see them. And from the clinical perspective, I mean, the artificial intelligence part of the story, and also looking at center-specific success rates, helps in improving the pregnancy rates and therefore delivering better outcome as far as our patients are concerned.
We somebody, I mentioned to somebody yesterday that we're going to be doing the show, and he had a question for me, and he said that he was told that he does not have any sperm, but then he was told that there may be a sperm somewhere in his body that does not come out. And I don't know if there are any cases where you can hunt for sperms where sperms are created.
Yeah, I mean, there are so many ways where we can get sperm, whether you can get it by ejaculation, or you can get it by us going directly into the testicle and getting sperm. And so there are so many different combinations. But if somebody doesn't produce sperm, period, and there are situations like that, there is no way one can find sperm. I mean, there are very, very rare circumstances whereby that does not allow this to happen in terms of finding sperm.
Yeah. Because he said, he had his sperm analyzer that told him he doesn't have any sperm, but somebody told him, when people are desperate, they listen to anybody, and he was told that there may be, in an area where the sperm are formed, there may be something there they can retrieve.
It all depends on the situation. So, I mean, you don't want to take people on a ride whereby the outcome is dismal or zero.
Sure.
Therefore, it is incumbent on those people to see the most specialized, physicians in the field that will help them, will guide them in that process. Sure. And sometimes to tell them that there is no option of getting sperm or eggs or whatever. I mean, the same thing applies to women. If women go into menopause, the chances of getting an egg is zero from that person.
Sure.
Utilize donor egg or in the case of men, donor sperm.
Yeah. What we're going to do is we're going to take our first break, and we'll be right back. Please stay tuned.
Sure.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics, according to Week magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio toll-free at 855-952-9600. 855-952-9600.
Welcome back, and thank you for being with us. We're talking to Dr. Shamma about family health. This is a very important topic, and Dr. Shamma, before we went on a break, we were talking about the health of, or some of the updates and the new stuff that are taking place in IVF, and now we're going to move to something we did allude to it a while back, and that is tests before pregnancy or before marriage, or I remember in Lebanon, if before you get married, you have to go get a blood test and then submit it to the authorities. Otherwise, you wouldn't be, they won't allow you to get married legally. So it's not the case in America. What kind of tests should people take? Why are they important?
Very interesting. A lot of testing ought to be done, and a lot of evaluation ought to be done in women and men, for that matter, preconceptually. They should have the healthiest lifestyle in general, both of them, to allow them to become parents. That goes without say. But on the other hand, from a genetic perspective, and we didn't address a lot of the new genetic stuff that we're doing in our field, From a genetic perspective, let's start from the background. In the United States, currently, around 6 to 8% of every couple conceiving will have a particular not very good gene that they share with their spouse or with their partner. So to make a long story short, those 6 to 8% of people could be at risk of passing both genes to the child, and they wouldn't have any symptoms themselves because these are generally recessive genes. But when both of those genes come together, then the baby could be affected. And 1/4 of the time, 25%.
Mm-hmm.
So therefore, a lot of parts in the world will advocate for the common genetic disorders for people before they get a marriage license, for instance, for them to be tested for those particular disorders. And currently, just to put this in perspective, every single patient coming to us trying to become pregnant, these are, remember, I mean, I don't see the people that get pregnant all by themselves.
Yeah.
People that have difficulty conceiving, every single couple, we offer them what we call carrier screening to find out if both of them have genes that they share or have X-linked genes or other genes that are important so that we can mitigate against it in the embryo, because we can check the embryo for those particular disorders and don't choose that embryo for potential transfer. So this is, I mean, we check currently around 800 different genes, believe it or not. To put this again in perspective, some 15 years ago, we checked 2 genes. And I can foresee that in the not very distant future, meaning in the next 5 years, every gene will be tested. All 25,000 genes that we have humans. Now, it raises a lot of, remember something, half of pregnancies that happen in the United States are unintended pregnancies. So people, doesn't mean that they're not wanted, but they're unintended.
Unplanned, yes. Yeah.
Unplanned. Yeah. Meaning, I mean, it's hard sometimes to control all of this, but it might be useful for people before they embark on a potential pregnancy, if they're willingly trying to do that, for them to be tested, because literally we can mitigate a lot of those heartbreaking genetic disorders in the next generation. But unfortunately, that's not the case in the US. Anybody can.
Yeah. What could you give us an example about those disorders?
I'll give you an example, a very simple one. Cystic fibrosis. It's a very unfortunate disorder that happens and affects the lungs of a lot of kids, babies, and so on. And 1 in 27 of us are carriers of the cystic fibrosis gene. The key is not to find that other partner that is one of the 1 in 27. Because if you both have that same gene, 1 in 4 of your kids will be affected. Still, it is rare, because remember, it's 1 in 27 squared multiplied by 1 in 4. So the situation gets to be, still a rare event, but 2% of around 2% of babies will be born with a genetic disorder that can be prevented.
Exactly.
And that's the whole point. From those 6 to 8% of people that are carriers, around 2% of kids will be affected with a particular genetic disorder. And that's what we're trying to prevent. And unfortunately, it raises a lot of ethical issues. And I understand that totally, because, it doesn't mean that everybody's going to do it. Can you enforce it prior to getting a marriage license? I don't know if that's doable in the current environment that we live in, especially in the different states. So there's a lot of work that still needs to be.
Yes. I did some research, and I tried to get a lot of people to get on the show, and we were not successful. The research showed that historically in the United States, there were requirements for people to submit the blood test in regard to syphilis, in regard to other diseases. And then they did away with it in the 70s and the 80s. And I don't know, nobody could explain to me why. And nobody wanted to touch that subject, which tells me there's some politics somewhere involved in it. And it's unfortunate when politics gets in the way of medicine and science, you know, and it's unfortunate.
Let me tell you, it is unfortunate only in the sense that all of those diseases could be eliminated, mitigated against,
Yeah,
if it's done universally. But remember, again, I mean, a lot of people have kids without planning for them.
sure, sure.
And those kids are beautiful, wanted kids, and so on. And therefore there is a lot of discussions that ought to be done society-wise to embark on a policy that becomes enforceable in a sense.
Yeah, education is key, it seems to me in this case, in which people need to be educated on the importance of that and the importance of health and the importance of having a healthy family to do that. Is
Sure.
there a way to, when you look at a sperm, to say this sperm does not have certain genes and I can use this, not that one?
The answer is no.
Okay.
Because remember, a sperm or an egg is made of just one cell. You
Okay.
analyze the cell, you kill it.
Okay.
So it's always done in the embryo
Okay.
itself. And
Okay.
what we do, for instance, in genetics, in the laboratory, is once the embryo becomes around 200 or so cells, we take 5 cells out and do the analysis on the 5 cells of the embryo, and the rest of the embryo remains intact. And we analyze those 5 cells for whatever we need to do and so on.
Mm-hmm. Mm-hmm.
I mean, talking about developments that are happening currently, almost 90% of all embryos that we put are genetically tested, meaning we put the healthiest genetically normal embryo as best we can, check for it. And the future is moving to what we call, currently we use technologies which is called, direct template amplification in those cells to analyze the cells for genetic normals.
Mm-hmm.
Eventually, in the future, we're going to use technologies probably involving whole genome sequencing, where all the genome is sequenced and those embryos are put in that are normal. And it's a slippery slope, because eventually we can check for everything.
Sure. Sure. Sure.
Call polygenic risk
Mm-hmm.
screening for, let's say, intelligence, for height, for eye color, for risk of diabetes, for heart disease, whatnot. And the question is, when do you stop checking? Because, think about it. There's been awesome humans on this planet that have issues. Stephen Hawkins,
Yeah.
whatever. Can you imagine if I eliminated whatever genetic predisposition that Stephen Hawkins had, and
Sure. Sure.
that he provided us, and so on. So all of those have ethical issues that have to do with social equity, with discrimination, with designer babies and whatnot. And those are subjects absolutely for discussion for the future,
Mm-hmm.
before we embark on those journeys.
Yeah. If we were to convince the legislator to have some kind of a requirements, what kind of a test are we talking about? Is it a blood test? What kind of test it is that should be required?
It doesn't have to be a blood test. It could be a saliva test. So
Saliva test. Yeah. Yeah.
Extremely simple procedure that is done. And there's a cost attached to it. Everything, there's a cost.
Sure.
People do the test, and machines do the test, and companies do provide the test. So all of those, the economics of it has to be put in place, but it costs a couple of $100 usually to do the testing of all those diseases on one simple sample.
Mm-hmm.
So
Mm-hmm.
we recommend it for certain, as I told you, in our field, but then what the state wants to do or doesn't want to do is a different story. The other part with it is weird is, for people like me in the field that are, leaders in our subspecialty and so on, nobody talks to us about this stuff.
Yeah. Yeah.
And nobody comes to us and say, "What do you think, Dr. Shamma, about any of this stuff?" And I was like, "Okay, I've been doing this in Michigan since 1992, so 33 years, and nobody ever knocked my door and said, okay, where do we go from here? What do you think we should do or not do?" Nobody.
Yeah. Yeah. There is a public health committee, and there's so many different, I don't recall, 15 or 20 different legislators on that. And I wrote to most of them, and I
Yeah.
just wanted to see what they say about it. And they didn't get back with me. even I was surprised that even some of the foundations that are pro genetic testing and all of that did not want to get involved in this. And I'm like, well, there's got to be a way where we can make this, the making of family healthier, better, and away from politics.
Politics permeates society. So at the
Yeah.
end of the day, policy is driven by science, I hope,
Yes.
and some politics.
Yeah. I mean, we create I don't know, $1 billion bomber, and then it falls into the sea, and then we're okay with that. And however, when it comes to making community by design, intelligence, and all of that, we shy away from that, and it's really unfortunate. But what can we do? We can't control that.
No, none.
Yeah.
Just live there.
That's the way it is. But we promise you, I'm gonna continue looking into this, and if I find the right people, I would like to get a panel together and find out what they know that would help us. And I'm really amazed that they wouldn't talk to experts like you, or to really get make the right decision.
Nobody ever in 33 years from the state of Michigan ever talked to us, except, I should say, when we enacted that gestational surrogacy law back in last year and this year.
Yeah. Well, I think they should. Yeah, I think they should. So, what we're going to do, Doctor, is we're going to take a short break. We'll be right back. Please stay tuned.
حاولنا كتير.
خلينا نحاول كمان مرة.
الكلفة كبيرة والاحتمال ضعيف.
يعني ما في أمل؟
للأسف حبيبتي.
هنالك أمل لدى مركز إخصاب IVF ميشيغان الذي صنف من بين أفضل 50 عيادة إخصاب في أمريكا وفق مجلة نيوزويك لعام 2023. ويعتبر الدكتور نيكولاس شما مؤسس مراكز IVF ميشيغان وأوهايو من أهم أخصائيي العقم في أمريكا، حيث أجرى أكثر من 20,000 عملية طفل أنبوب ناجحة حققت حلم الأبوة لكثير من الآباء والأمهات، وهو حاصل على البورد الأمريكي في أمراض النساء والتوليد والعقم والغدة الصماء التناسلية. الآن ولفترة محدودة خصم $1,000 للحالات المؤهلة لإجراء عمليات في عيادات IVF ميشيغان. لمزيد من المعلومات يرجى الاتصال على 2489-529600. IVF، أمل يولد من جديد.
Welcome back, and thank you for being with us. This is Khalil Hachem. We're talking about family health. We're talking with Dr. Shamma. Doctor, what kind of vaccines before, during, or after pregnancy, if needed after pregnancy, are important for women to or men in that case that should consider to help them produce a more healthy for them and for the child too?
There are I think we should look at it in two different ways. What are some of the vaccines, Khalil, that are recommended before you get pregnant? And what are some of the vaccines that you take during pregnancy? So these are two different things. One of the critical vaccines actually that need to be discussed is something called the MMR vaccine. That's the measles, mumps, and rubella vaccine. That ought to be done before pregnancy by at least a month, because it involves a live virus in it, attenuated but live virus in the rubella part of the vaccine, and that prevents rubella happening in the mom, and therefore eventually affecting the baby, which could have very, very serious issues related to the heart, to the brain, and so on for the baby. So that is one of the vaccines. The other one is clearly the hepatitis B vaccine ought to be considered strongly before pregnancy, because so that this way when mom is immune, she's not at risk during pregnancy, and especially the baby is protected in that sense. There's another vaccine that we advocate given to women, given to all of us every 10 years, which is something called the DPT vaccine, the diphtheria, pertussis, and tetanus vaccine. What we do in those situations is we recommend that so that especially mom is protected and the baby doesn't develop whooping cough, which is pertussis eventually when the baby is born. And actually, it's one of those things that we recommend eventually for mom to take during the pregnancy if she didn't take it and
Sure.
she's so that again the baby is protected in the first few months of life before the baby himself or itself is given that vaccine. So it is recommended to be given during the pregnancy for in that situation, somewhere in the third trimester. And then there are other obvious vaccines. I mean, these are the vaccines, for instance, that involve influenza. These are seasonal vaccines that happen during the flu season. There's another vaccine actually that we recommend, which is basically the COVID vaccines. And interestingly enough, as of what was it, the date? Sometime around May 25th, the CDC said, well, pregnant women do not need to take that vaccine anymore, the COVID vaccine. The American College of OBGYN clearly disagrees with them. And that's, again, has to do with politics.
Sure.
Because women, if they get COVID during pregnancy, are at risk of significant complications. So we recommend, definitely, at least personally, for sure, that all women trying to become pregnant to get the COVID vaccinated. And the best vaccine currently, in my opinion, that is available would be prior to pregnancy to take is the protein-based vaccine, the Novavax vaccine. And I've talked about that before. As opposed to the RNA ones, it lasts a little bit longer, to say the least, and has less side effects for people taking it. So those vaccines ought to be done pre-pregnancy. During pregnancy, clearly, the as we said, the flu COVID vaccines could be given, and also the Tdap vaccine for the pertussis prevention.
Sure.
Somewhere between 27 and 38 weeks prior to delivery. So all of those vaccines are important to do. And then there's also the RSV vaccine that's also given between 28 to 32 weeks. Again, to protect the baby before the baby gets the RSV, because knowing that respiratory syncytial virus, that's the disease that the babies can have, is preventable until the baby gets the vaccine itself and therefore develops its own immunity. So it's a way to bridge that gap before the baby can get the vaccines.
Absolutely, yeah. Are these vaccines expensive?
Very inexpensive. Very inexpensive. And if you actually look at the risks of the vaccines, the cost of vaccines versus the risk of developing, let's say, whatever, whooping cough in a baby, or the risks of mom dying from influenza, or mom having significant pneumonia for influenza or COVID during pregnancy, or clots because of COVID in pregnancy. I mean, there's no comparison.
Sure.
No comparison, Khalil. So
yeah. My youngest sister died of RSV after she was born within 15, 20 days. And back then, they really didn't understand all of these things, and they didn't know. And
have a vaccine back then. Because the RSV vaccine available now, there is a very effective one currently available.
There's a even though it's not related to vaccines, but there was a question that was sent to me. As far as, and this is common in the Middle East, cousins marry each other. Is that a problem?
Okay, that actually dovetails, Khalil, on what we discussed before in terms of carrier screening. Here's the thing. I mean, I'm going to start with basic genetics.
Sure.
Share 50% of the genes with our parents and 50% of our genes with our brothers and sisters. That's why we don't marry brothers and sisters. I mean, it's obvious. We also share 25% of our genes with half brothers and sisters. and we share around 12.5% of our genes with our cousins. At least there is a higher percentage of consanguineous marriages, meaning marriages, you marry your first cousin, your second cousin, and so on. And that's more common in, let's say, in the Arabian Peninsula than it is in, let's say, Lebanon, which is
Sure.
And in those situations, those genetic recessive disorders that are prevalent in the population becomes more of a concern if you share 12.5% of your genome with your spouse, partner. So therefore, it is imperative in those circumstances to make sure there are no genes in common. And that's why genetic diseases are a lot more prevalent in the Middle East, in our societies, than elsewhere on the planet, actually.
Sure.
In India, there are similar situations, but generally speaking, people don't marry their relatives.
It's always better to get outside of that pool of
genetic diversity is always recommended.
Yeah.
Because then, I mean, you are not at risk of having, don't have an increased risk of having those particular genetic disorders. Yeah.
It helps a lot. Yeah. And again, education is key there, and people want to keep it in the family.
Want to keep it in the family. But now, in certain countries, let's say in Saudi Arabia, before you get a marriage certificate, you have to have carrier screening to be able to sort out those people that marry that are at risk of genetic disorders. Now, I don't know off the top of my head how many genes they are checking these days in, let's say, Saudi Arabia, but I know that that's a fact.
Yeah.
And it is a very progressive, thing that is happening over there that doesn't happen here.
Yeah. Because not long ago we were at a religious gathering, and somebody was asking the question, and the imam said, "Ask the experts. I'm not an expert on genetics, and I'm not an expert on pregnancy. Ask the experts, and the experts will tell you whether you should, continue bringing your relatives from overseas and marry them." He said, "We live in a time where we have science, we have experts. Just because I can give speeches, it doesn't make me an expert on genetics." So, and then I agree with him. Ask the experts. We have this opportunity. Our community has a great wealth of experts here. We should really ask them.
I mean, clearly. I'm no expert in marriage either, but I should tell people that they should marry people that they love them, period. And all the other stuff is fluff.
Sure. But I mean, when it comes to reproducing children, as we discussed before, we should have the responsibility of at least doing it as right as possible.
You should try your best
to
do whatever you can to ensure a healthy mommy and a healthy baby that eventually grows and becomes productive in society.
Yeah, absolutely. Did we cover the issue of vaccines totally? I want to go back to that.
I think this is it as far as vaccines. I mean, people need to know that they need to be as protected before pregnancy, going into pregnancy, and then there are some vaccines that ought to be given while they're pregnant, and we can do both of those. And people that seek OBGYNs or subspecialists like myself and so on in those areas, we tell them what needs to be done and what doesn't need to be done in those situations. We test them for those. Yeah, I mean, that should be enough.
Yeah. Do you think experts should put together a flyer, with all of the recommendations, and should be given to religious institutions and say, when people are getting married, give them this flyer, as a gift from us?
I mean, education is key.
Yeah.
Education, everything in life, whether it is you're going to buy food, or you're going to buy a car, or you're going to become pregnant, so education is key. And therefore, Currently, all of this is available. You just
Yeah.
need someone to
Yeah.
go and research this. They're trying to have a kid. Okay, research what needs to be done. You need to be having a healthy lifestyle. We're going to talk in a little bit. I think you told me that about, let's say, some endocrine disorders that are associated with some adverse effects for baby and mommy during pregnancy. And we ought to do that. And people need to be as healthy as they can. We need to educate them. This education is available through experts like myself and so on in those areas, but
Exactly.
they can do a little bit their own research.
Yes. Yeah.
find
Yeah. Yeah. Yeah.
It's all
I-
available. It's available ubiquitously, as they
Yeah,
say.
yeah. I recommended forming in this community. I recommended forming a public health committee that can take a look at these things, put them together, talk to you, talk to everybody, put them together. Because individuals are not going to do it. I mean, very few do, but most people are not going to do it. But providing this committee will take a look at this, make recommendations, and give them to people so that they can help them to get better at this stuff.
Absolutely open for this, especially in our, let's say, Southeast Michigan and so on.
Yeah. Yeah.
Our Middle Eastern community is definitely there and available, and they're absolutely, in my opinion, willing and able to listen to people.
Absolutely. Thank you. What we're going to do is we're going to take our final break. Please stay tuned. We'll be right back.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases and has helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio toll-free at 855-952-9600. 855-952-9600.
Welcome back, and thank you for being with us. We're discussing family health with Dr. Shamma. Doctor, we're going to talk about managing blood pressure and diabetes during pregnancy and any other issue you deem necessary that people need to know, along those lines. And what's the best way to manage that?
Is to have it managed pre-pregnancy, Khalil.
Yeah.
You don't want to go into pregnancy being diabetic. You don't want to go into pregnancy being hypertensive. You don't want to go into pregnancy having thyroid disorders. You don't want to go into pregnancy having a BMI of 45 if you can. BMI standing for body mass index, meaning if
Which means overweight. Yeah.
Overweight is something, obese is something else. So
Okay.
and so the issue is you try to be as healthy as possible as far as mommies are concerned prior to pregnancy. And in my opinion, managing, let's say, diabetes is critical because we know for a fact that the worse you're being managed or you manage yourself, the worse the outcomes for the baby, not just in terms of having complications, but in terms of actually congenital anomalies for the babies. The sugar in the blood affects the risk of congenital anomalies. So therefore, every single patient coming to us, we will actually not do a procedure in them, in vitro fertilization procedure, unless their hemoglobin A1C, which is one measure of glucose control, is less than 6.5. And we always advocate, because there are certain groups of people that are at risk of pre-diabetes or resistance. Those people, and those are the people, for instance, I'm being a little bit technical here, their fasting blood sugar is between 100 and 125, or their glucose tolerance test is between 140 and 200, or their hemoglobin A1C is between 5.7 and 6.5. Those groups of women, we always advocate lifestyle management, meaning weight loss, and a lot of times we put them on a medication called metformin that is safe in pregnancy to help them lower their hemoglobin A1C so that they can go into pregnancy safely. And sometimes you need insulin. And a lot of people who are already diabetic are already on insulin. So all of those things ought to be managed as strictly as possible to prevent complications during pregnancy for mommy, and especially for baby in a preconception situation, and of course during pregnancy, because during pregnancy your fasting sugar ought to be, for instance, between 60 to 100, and your post-meal sugar should be somewhere around maybe 125 tops. So to make a long story short, all of those things ought to be managed as strictly as possible to safeguard the health of the baby and to some degree the health of mama.
So when we say lifestyle, what are we talking about?
I mean, lifestyle, obvious. I mean, you should maintain a good weight, eat healthy diet, organic foods. You should avoid smoking, avoid alcohol, avoid recreational drug use that are bad for you, and so on. So all of those things, and clearly make sure that you don't expose yourself to sexually transmitted disorders. So all of those things ought to be looked at as, again, part of not just genetics like we talked before, but part of normal preconception health in general.
Avoiding sugar and exercise, does that help reducing blood sugar in the risk of diabetes?
Most of us can eat carbohydrates and so on, talking about sugars in general, without having an untoward effect, except that some of us are genetically more predisposed to develop diabetes. That's why it doesn't happen to everyone. And those people should take, extra carefully in mitigating the effect of high sugar during pregnancy and so on, and in general in life.
Because some I've noticed some women have a tendency of eating a lot of food during pregnancy, and I'm like, eating a lot doesn't mean should be a lot more selective.
I mean, a funny thing that happens all the time, because we in our field, I see people the first 12 weeks of pregnancy, and then we send them to their OB. So we make them pregnant, and then we package them, and then they go to And a lot of them say, well, how much extra do I need to eat? I mean, I said that, the whole baby is maybe 2 millimeters. How much do you think it needs for food?
It's amazing.
Generally speaking, you need to gain a reasonable amount of weight in pregnancy for the baby's sakes, around maybe 20 pounds, but that's it. And if you're overweight, maybe you don't need to gain.
Do pregnant women develop an appetite for food, or this is more like a cultural thing? Oh, I'm pregnant, I gotta eat for the baby.
Well, some people eat less in pregnancy. I mean, because in the first trimester, you're nauseated most of the time. And some people have morning sickness and whatnot. And so they sometimes lose weight. So, I mean, pregnancy accentuates physiologically a lot of this, the smelling power of women. So some women become more sensitive to smells and foods, and that's maybe not make them lose weight sometimes, or avoid certain foods and so on. So having a healthy diet, or a healthy or better management of diet, is the way to go. And sometimes for those nauseated women, we actually give them medications to prevent, that nausea from completely causing.
Sure. High blood pressure, is it similar to diabetes, or is it just totally bit different way to manage it?
It's maybe worse to some degree as far as mommy is concerned. It carries risk for mommy during pregnancy, especially if you get superimposed pregnancy-induced hypertension for it. And those issues, I mean, thank God most young women are not hypertensive.
Okay.
Right? I mean, most of them. Currently, because of obesity becoming more prevalent, more and more women are hypertensive. And we see that. And therefore, good blood pressure control pre-pregnancy with appropriate medications. Some medications you cannot give while pregnant because of the major teratogenic risk as far as the babies are concerned. But if you're adequately, let's say, managed, you should have a safer pregnancy. You're still at a high risk, but you're still having a safer pregnancy than if you're coming into pregnancy with hypertension.
What causes high blood pressure?
Oh my God, I wish I knew the answer. But a lot of people, I mean, a lot of us on this planet have hypertension, and it's a myriad of factors. Some of them are endocrine, some of them are physiologic, some of them I'm sure are hereditary and so on. And interestingly, a lot of hypertension currently in general is undiagnosed. People don't go see doctors, don't have their blood pressure checks, and it's one of the major killers for humans. So adequate blood pressure control is critical in maintaining general human health, and therefore life expectancy is affected if you're mismanaged as far as that is concerned.
Yeah. What are the signs? Like, how do I know that I have high blood pressure?
The best sign is to have your blood pressure checked, Khalil.
Yeah.
You check your blood pressure, we know that you have blood pressure. But I mean, there are certain signs when it's really bad, you develop headache and so on and so forth. And sometimes it can cause end organ damage. Right? Low blood pressure for years and years can affect your kidneys, can affect your eyes, can affect your brain, and so on. So all of those things, I mean, you want to detect them as early as possible and treat them as early and as effectively as possible as soon as you make the diagnosis.
Yeah. We have 8 minutes or 7 minutes left.
Okay.
I would love to talk about AI and what could contribute to what you do for success-wise, unless you have something else that you want to bring up, that people need to know.
All right, couple of things.
Yeah.
I think one of the main reasons that IVF Michigan joined Pinnacle Fertility is because of the tremendous power that organization has, and it's one of the leading fertility practices in the United States now, in transforming our field into the next generation, incorporating artificial intelligence and deep machine learning in the processes that we do, and make standard operating procedures across the platform, and allowing patients to actually benefit from, site-specific, doctor-specific recommendations that are tailored for those people to achieve the best success rates. So that is the beauty of those very powerful groups or consortium of fertility practices like Pinnacle Fertility that we have in the US. And so the deep machine learning, as I told you, is in the analysis of the data. How we use this data in improving outcomes, whether the way we stimulate people to make them produce eggs, whether the way we incorporate that in the laboratory. To give you an example, currently we use certain, I'm going to use a term, I apologize for my patients, morphometric changes, meaning we look at embryos in real time over the days that we have them in the laboratory. Well, we do that using humans and computers, but artificial intelligence can look at this at a very, very deeper level than we can, and allow us to sort the better embryos in those processes for us to put them back. Another thing that we mentioned earlier is it allows us to sort the best sperm to put back, to put inside the egg to fertilize the egg. Not just rely on visual representation of whatever sperm we choose or pick and so on. So all of those things are moving us into, I'm going to call it fertility 2.0 in the next 5 to 10 years, that would revolutionize how we do things.
Things are just moving so fast.
See, the beauty about our field is this. By the way, I just want to correct something that happened prior, is that according to US News and World Report, consistently over the many years, we're the number one in Michigan. So not just 2023. That's
Sure.
one. Second
Sure.
is if you think about this, the future is very promising in our field because
Yeah.
only started in 1978. That's the first human born on this planet was Louis Brown in England, 1978. And when I did my residency and fellowship at Yale back in between 85, 86 to 92, it was, we just barely started doing this. And imagine how much technology and how
Yeah.
much progress we've made in the past, let's say 45 to 50 years, is mind-boggling. And
It is.
what
It is.
we're able to do, Khalil, in the future is, I mean, I envision what would be the case in another 50 years from now using artificial wombs, artificial ovaries, scaffold. I mean, all of this stuff is pioneering stuff that will happen eventually in our field, but it's just
It is.
amazing what the human intelligence can do, and in this case, with the help of artificial intelligence.
Yes, absolutely. I mean, I remember when I bought my first computer in '86. It was a 286. It was a huge, big thing, and all the codes we used to do. And look where we are right now. I mean, we have computers as small as a tip of a pencil. It's just amazing. It always amazes me. You know, hopefully we use it for the good.
Yeah, I mean, for some of us that use Macs, it's a different story because I've had every single Mac computer from inception. I wish I kept the first one because I
Yeah.
could have sold it now for God knows what without using it.
Yeah, I've been using Mac since 2000, so and I don't want to go back. So
Mine since 1986, I think.
yeah, absolutely.
Yeah.
We got 1 minute left, Doctor.
I mean, what in the 1 minute that is left, I want to emphasize a few things. Number one, adequate preconception screening / counseling is imperative in women trying to achieve a pregnancy, to have the safest pregnancy for mommies and for babies involved. The second part is utilize experts and experts' opinions and technologies in our field that can help couples have the safest, most efficient way to achieve parenthood, and seek us. We are there to help.
Absolutely. As always, it's been a pleasure talking to you. And thank you so much for all this wonderful information you're sharing with our listeners.
And my regards to all our listeners across all different platforms.
Absolutely. Thank you.
You take care.
Okay. Bye now.